In this video, here's what we'll cover: why this week's studies matter, better sleep lifts mood and anxiety, work stress, change the job, not just the worker, emotional skills and how therapy helps, what to focus on first. Think about how a single bad night can color a whole day. You wake up afraid, small problems feel bigger, and by mid-afternoon your patience is gone. Now stretch that over weeks or months, add a job that never seemed to ease, and feelings that keep spilling over, and you have the shape of what many people carry into our clinic. Each week I round up the research worth knowing about across therapy, counseling and mental health, and I put it in plain language. This week 3 threads kept tying together, and they are threads from ordinary life, sleep, work, and the skill of handling our own emotions. None of them are glamorous. All of them, done well, change how a person actually feels. Before I start, one honest note about how I read this. I only draw on credible, primary sources, like peer-reviewed journals and official health bodies, and I treat new findings as emerging rather than settled. A single study rarely changes practice on its own, and the size of an effect always has to be weighed against how certain the evidence is. Let me begin with sleep, because this is the clearest signal of the week. Clinicians have long asked whether treating the sleep itself lifts mood, or whether poor sleep is just a symptom you can leave alone. A new review pulled together 54 randomized controlled trials, involving more than 10,000 adults, and compared treatments that improved sleep quality against usual care. 2 results stood out. When sleep improved, depression fell by a meaningful amount, not a rounding error, and anxiety fell too, with a result that was even more consistent across the studies. There was a third finding that matters just as much. General stress did not shift. So sleep is powerful, but it is not a cure-all. The careful reading is this: these trials varied a lot, so I hold the exact numbers loosely, but the direction is clear and useful. When someone comes in with low mood or anxiety and broken nights, treating the sleep is one of the highest yield places to start, and that does not always mean medication. The second thread is work. Roughly 1 in 5 working adults is affected by a common mental health condition in any given year, and it usually shows up at work first. Exhaustion, brain fog, missed deadlines, sick days. The reflex is to send the person off to therapy and hope they come back fixed. The more interesting question is whether changing the work helps more than changing the worker. A systematic review this year looked at exactly that. It focused on work-focused programs that go beyond individual treatment to include organizational change, modifying the job itself, adjusting duties and workload, and getting managers actively involved in the return-to-work process. The consistent signal was that outcomes improve when the job is adjusted and the manager cooperates, rather than when the employee is simply told to build resilience and cope harder. This is a review of a complex field, so I read it as a direction of travel, not a precise dose. But it matches what I see every week. When work is the source of the distress, just manage your stress better is rarely enough on its own. The durable improvement comes when the load actually changes. Work stress is a shared responsibility, not a personal failing. The third thread ties the first 2 together, because how we handle what sleep loss and work pressure throw at us is itself a learnable skill. The evidence here is not brand new, but it is a landmark synthesis, and it remains the clearest map I have of how therapy helps. It pooled 90 randomized controlled trials, with more than 11,000 participants, to ask whether psychological treatment actually changes a person's emotion regulation skills, and whether those changes track with getting better. The findings were striking in their consistency. Treatment improved emotion regulation by a moderate, reliable amount. Depression and anxiety fell alongside it, and the 2 were linked. The people whose regulation skills improved most were, on average, the people whose symptoms improved most. Emotion regulation is not about suppressing feelings or thinking positive. It is the skill of noticing an emotion, understanding it, and choosing a response, and it can be taught. In adults, that is much of what good therapy does. In children, it is largely built through play, where the skill can be practiced safely and repeatedly, and where the gains often pay off for years. So which of these should you focus on first? Start with the thread that is loudest in your life right now. If you are lying awake most nights, treat the sleep, because it is one of the best evidence places to begin. If work is a grinding source, the answer is rarely just cope harder. It usually means changing something about the job alongside support. If feelings regularly overwhelm you or your child, building emotion regulation skills pays off, and if any of it is severe or getting worse, a careful assessment is the fastest way to match the right help to the right problem. If any of these are shaping daily life for you or someone you love, you do not have to work it out alone. Our team at Potentialz Unlimited in Bella Vista offers comprehensive, evidence-based assessment and therapy for adults and children. You can read the full roundup, with links to every source, or get in touch using the links in the description below. Before you go, here's a quick recap of what we covered. Why this week's studies matter. Better sleep lifts mood and anxiety. Work stress. Change the job, not just the worker. Emotional skills and how therapy helps. What to focus on first.